I see Sergeant Major Buchanan has a question. Go ahead, Sergeant Major.
Hey, ma'am, I appreciate you answering all these questions and being here. So I want to give you a scenario. If I'm a soldier, I got my first shot, I go TDY, and I am due for my second shot. Am I authorized to get a shot at another location, providing it's the same vaccine?
That's an excellent question. I am not going to go so far as to say that you are authorized to receive the vaccine anywhere else. I think it depends a lot on the time frame that we're looking at, right? So Moderna and Pfizer have said that you can delay the vaccine, okay? So if you were to get it a month later, you should still receive it. I don't think there's a lot of data that looks at the effectiveness if that second shot is delayed probably past 40 days. So, I mean, if you're looking at an individual, I'm sure there may be some flexibility in trying to arrange that second shot elsewhere. If you're looking at a larger group of people, I would imagine it could be a little bit more challenging. And part of that is also because every individual site has allocated vaccine based on their numbers, right? So, I mean, if you have large groups of people that are going to different places, there may be some challenges related to that. But ideally, folks would get it their second dose where they had the first dose.
Thank you.
You're welcome.
So Tom asks, if you have tested positive for COVID-19, when can you receive the vaccine?
So excellent question. So the recommendation is even for people that have had COVID in the past, they should still receive the vaccine. Now, the thought is that if you've had COVID, you are likely protected for about 90 days after receiving the vaccine. The CDC doesn't give strict guidance on this. What it says is that you can receive the vaccine after you have recovered from COVID. Okay, so if you are still acutely sick, even if it's been 3 weeks or 4 weeks and you're still ill from COVID, you should wait until you have completely recovered. But it would not be unreasonable to wait 90 days, okay, to be vaccinated, as you will likely still have some antibodies from when you had COVID. So again, you can look at it a couple of different ways. The answer is yes, you should receive the vaccine even if you've had COVID, and should wait at least until you have recovered to receive the vaccine. But it would not be unreasonable even to wait up, to 90 days after having contracted COVID. Now, if you have received monoclonal antibodies or convalescent plasma, which probably no one on here has, but if you have family members, they should wait 90 days. That is the recommendation.
Daniel would like to know, without longitudinal studies, how can we feel safe about the long-term effects of the vaccine? I keep hearing the argument that COVID could also have long-term effects, and it doesn't make him feel any better about getting the vaccine.
That's a good question. I mean, for me, full disclosure, I actually had COVID, and it wasn't fun, and it was scary for me, and a lot of it was mental fatigue and mental worry about, was I going to end up in the hospital, or was I going to end up intubated on a ventilator? Was I going to die? Was I going to transmit it to my family? So, I think I have maybe a little bit of a different perspective about the vaccine. As a medical professional, I trust the medical community, and I know some people don't. I think although the vaccine itself is a new vaccine, the data behind the vaccine is not new. And so when I look at over 400,000 people in the US alone having died from COVID, to me, it's worth it. But I know it's challenging. It's tough to know what the right thing to do is. And again, I'm not here to try to, I'm here to educate and inform. And I'll be the first to say we don't have all the answers, but we know COVID can be a deadly disease. We know that the vaccine, again, although a new vaccine, the data behind it and the mRNA, they're not new. And so for me, I feel confident telling you that I think it's safe.
Thank you. Otha would like to know, if a person is scheduled for surgery, is it safe to take the vaccine, or should they, before the surgery, or should they wait until after the surgery?
So that's a great question. As a surgeon, I would encourage all my patients to get the COVID vaccine. The one thing I will say is that, we talked a little bit about some of the side effects from having the shot. So I think most people who maybe don't feel well are going to not feel well within like the first 24 to 48 hours after receiving the vaccine. So if you then have a low grade, fever after receiving the vaccine and you go into your doctor's office for surgery, and you're not feeling great, they may have some questions for you about whether to proceed with surgery. So, there's no data out there that tells you that you shouldn't receive it the day before, but, I would probably talk to your surgeon and say, hey, I'm interested, or I have an appointment to receive the vaccine. Do you have any recommendations about timing for my surgery? But again, for me as a surgeon, it's always tough when a patient comes in the day of surgery and they don't feel great. And that brings up a question about whether to proceed with surgery. So, I think if you're, at least a week out, you're probably good, but would definitely recommend to touch base with your surgeon about that.
Joyce would like to know, if you are not 65 and older, but an active government worker, can you come in at any time right now to get the vaccine?
So if you are not 65 or over, but your phase has passed. So if you are in phase 1 alpha or 1 bravo, so emergency worker, healthcare worker, DODEA school, I think commissary, deploying soldier, critical national capabilities. If you missed your phase, yes, you can still walk in or call and make an appointment to schedule. Anybody who has not yet gotten to their phase, no, not quite yet.
Hey, Nia, I'll give you about a 30-second break here where I can add a little bit to that. So, okay. Hey, teammates, for those employees that have already gotten the shot, I will tell you the feedback real quick is the wait time is very, very small. In fact, the hospitals reported that they're less than 50% capacity on getting people through. And so if you're waiting, if your phase is here, please don't wait. You can walk in almost any time and go get the shot. Now, you might have 10 to 15 minute wait, and obviously you're going to speak to that PCM, or you're going to speak to a medical personnel right before you get the shot anyway. Go through that questionnaire to answer those questions or any questions you may have, and you still got a chance to make a decision then. But you have time to do that. It's not a rush job where they're going to sit you down and go, okay, you got 30 seconds, give me your sheet and get out the door. I went through not too long ago, and we, myself, Sergeant Major, and the rest of the team literally walked up. A couple other Garrison employees were there, but to hit our phase, there was no one there. So please don't think that you got to schedule an appointment and you got to put some time away. Now, that might change as we start going through those priorities. Individuals change their minds, and we open up those opportunities for more beneficiaries here. I know there's a couple questions about beneficiaries that are coming up that I think Chris will talk about here in a minute, like family members, right? So family members, well, if they work on post and they fall into those categories, yes, remember it's above 18 for the Moderna, if I'm right, Colonel Middleton, 18 years old and above. But right now on post, they have to be in those categories, right? Those are directed by Department of the Army. That is not Fort Stewart, Colonel Freeman, Colonel Middleton, and I coming up with those priorities. That's Department of the Army categories based on where you're at for readiness of the team here. So if your family member falls into those categories with their profession or current occupation, then by all means, yeah, they're going to go get it. If not, then you're going to have to wait till your priority comes up on those pieces. So hopefully it gave you a little bit of time to get a drink of water. I really appreciate it. You're still my hero. And I think we can go ahead and continue. So Chris.
I just saw Renee had her hand raised. You can go ahead if you have a question.
Thank you. I'm wondering if Colonel Middleton, if you could address perhaps some of the concerns as it relates to the mutation of some of these, of the vaccine and how the Moderna vaccine may help us with that.
Thank you, Renee. That's a great question. I was actually looking at some information about that this morning. So there are some COVID mutations that have been described in the literature and on the news in some other countries and a little bit here in the United States. The evidence has shown that the COVID vaccines that we have currently, Moderna and Pfizer, are effective against those mutations. The difference with these mutations is that a COVID infection with the mutation, it's thought to be a little bit easier to transmit the virus. So someone who has this new mutation may have more viral load. It may be easier for them to transmit the virus to other people around them. I have heard a little bit more recently that there are questions about the severity of these new mutations. So initially it was thought that it didn't cause any more of a severe disease, just easier to catch it. But it does look like there may be some strains that may cause more severe disease. So we do know that those mutations are out there, which is why we continue to recommend and encourage aggressive hand washing, social distancing, wear your mask. Even after you receive the full 2 doses of vaccine and we think you have antibodies on board, you still need to do those things. And again, the goal being to protect the community and continue to show, hey, that we're really engaged in trying to prevent COVID, and we want everyone else to follow these guidelines and practices as well. But again, at least the current evidence does show that this vaccine is effective against these mutations in the COVID virus.
I see Sergeant Major Buchanan. Oh, sorry, ma'am, go ahead.
Oh, no, go ahead.
I was going to say, I see Sergeant Major, you have your hand raised. Do you have something else to add?
No, sir, that was from the previous question. My bad.
Okay,
Hey,
we have 2 questions.
Chris, if I could hop in for Ms. Tressa. She wanted me to confirm if you work on post, does that include family members over 18 of DAX? And so let me rephrase that, Tressa. So it is not your family. So the individuals that can get those shots currently at Winn, they have to be beneficiaries of the hospital. So and right now for that category, that includes our contractors, not the family member of the contractor, the actual contractor. So if you are a contractor working on post right now and you fall into those categories, so you fall under the CYS program or the other DODEA and those pieces that we've already listed out, you and you alone are authorized to get the shot at Winn Army Community Hospital, not your family members. Your family members will have to go off post when that priority comes up, unless some other guidance comes from the Department of the Army further on down the road. So I hope that answers your question. Thanks.
Colonel Middleton, we have 2 questions reference the actual card you received when you would get vaccinated the first time. Malika and Gail both have questions about it. So Malika wanted to know, do we have to come in with that card? And Gail would like to know, she has a date for the 2nd dose, but doesn't see a time on there. So she needs to actually schedule a time to come in for that. Okay.
Those are actually great questions. So I would recommend to bring the card with you. If you forget or you don't have the card, we still have evidence in our system that you came in and on what day you received the shot. So we do have that data and can easily look that up. But wouldn't it be nice to have your card that you can show that, hey, I got my 2 doses, and if you want to post on Facebook, hey, I got vaccinated, for everybody else to see and encourage them to get vaccinated, then I think that's great. So it's a nice documentation piece to have it that you can easily show, hey, I was vaccinated with this vaccine on these days. But if you just, you can't find it or you forget it, not a problem. We have access to those records. And I'm glad you brought up the question about the dates. So you likely, if you haven't received notification, will within a day or 2 prior to your actual appointment, receive some type of notification that gives you a date and time. You can, again, come in on any time, at any time on that day. But say you don't get a phone call and you know that your vaccine per your card, your second dose is scheduled for, the 29th of January. Even if you do not get a phone call, you can still come in, walk in, and get vaccinated on that day. So don't let the fact that you didn't get a phone call or an appointment reminder keep you from coming in on that day to go ahead and get your second shot. Now say, oh my God, I can't come in that day, Monday, come on in.
Thank you for the clarification.
You're welcome.
So, Bill is curious, when will family members receive the vaccine? And I'm assuming that's family members of soldiers as well as TRICARE beneficiary.
That's a great question. And, I'm sure everybody is wanting to know that. So I know you're probably tired of hearing us say that we follow the phases, but we do. So, right now, again, we're 65 and over. The next phase after that is going to be 18 to 64 with chronic medical conditions or those that they think are at risk for severe disease. Okay. Now, the question may be, well, I have X, Y, and Z disease, so that makes me high risk. We look at medical records to determine that. So we already have a list of who is considered high risk, okay? And that will be the next category that we go into. Now, healthy family members, healthy beneficiaries, even healthy active duty who are not in those essential, soon to deploy categories are the last phase of people that are scheduled to get the vaccine. When that will be, I'm hoping as soon as possible, but we have to get through the other phases first, and it's a little bit hard to say.
So Sarah asks, where exactly do you go to get the vaccine? Do we start in the field, the park, then go into the hospital, or just go straight to the auditorium?
So after you call and get your appointment date, you will see some signs on posts. Right now, ideally, we would have folks parking over at Donovan Field, and that's where most of the signs are directing people, and that's the field right next to the hospital. The goal is to prevent people from having to walk long distances. So, as we're in that 65 and over, so people that may be a little slower moving, that may not be able to walk long distances, given the large numbers of people that we're anticipating, we right now are having people go through Donovan Field. There is parking actually in the lot adjacent to the emergency department for people 75 and older. Okay, so if you have older people or somebody who, is in a wheelchair or, has a handicap sticker, there is parking set aside right in front of the Winn emergency department for those people only. Okay, but otherwise we would prefer that people go to Donovan Field. Now, say you're 65 and you're here to go to the pharmacy and you parked somewhere else, you can, and you're here for an appointment at the pharmacy or the lab or at primary care, you can walk over and still get your vaccine. So we prefer people make appointments, but we want people to get vaccinated. So we're doing the best we can to accommodate people, as possible. The appointments help us determine how much vaccine we're going to need on a given day. So again, appointments are ideal, but we're going to catch people, if they're here and in phase through walk-in.
So Barbara would like to know, do you have any idea when Winn might start drive-through vaccinations, very similar to how you do the flu vaccination?
So I would say soon. I know that's not an exactly answering your question. We're definitely doing some coordination and planning right now to work on a drive-through vaccine similar to what we've done for the flu. We know that has been very effective in the past with vaccinating large numbers of people in a safe manner. There are some challenges related to the COVID vaccine that are a little bit different than something like influenza or the flu, just because, you may have heard that it requires a certain type of storage and cold temperature. And so we're really making sure that we, keep we want the vaccine to be effective. Okay, so we're making sure that we have good processes in place, that we're able to store it properly and safely, even if the temperatures are warm or if we're outside. And so that's some coordination that we're really working aggressively on to get that option out to folks in the community.
So I think we've exhausted all of our questions at this time. However, if you all have questions, please raise your hand or put it in the conversation thread.
I did have one other thing that I wanted to speak on very briefly. So, as an OBGYN, women's health is very special for me. And so I know that there's likely some questions out there for women that are pregnant or breastfeeding, or women that desire or are interested in getting pregnant. And the recommendation from the societies, so the American College of Obstetricians and Gynecologists and the fertility societies, in conjunction with the Center for Disease Control and Prevention, are that women that are pregnant or breastfeeding or interested in pregnancy should not, the vaccine should not be withheld from them. So they should be offered the vaccine within their phase, okay? So we do know that pregnant women who get COVID are at significant risk for severe disease. Again, there's no evidence of any long-term effects or concern. And so we really do encourage women in those groups to get vaccinated. So, that's one of the things that I've heard people ask questions about, especially women who are interested in pregnancy in the future. There's no evidence that there's risk of, congenital anomalies or birth defects down the road from getting the COVID vaccine today. So definitely would encourage those groups to consider getting vaccinated also.
We did have a question from Robin. She wants to know, do we need to bring completed 207s when we come in for the second dose, or will there be forms provided for us there?
So Robin, if you have the form, great, go ahead and bring it with you. But if you don't, we have plenty of forms there at the vaccination site.
And Tony would like a little bit more clarification on which contractors are currently eligible for the vaccine. Is it only certain areas? I'm assuming he means half for Fort Stewart, but if you can just address that real quick.
So yes, the short answer is it is only certain areas. Colonel Logan, do you have any comments about on the Garrison side, which contractors are eligible?
Hey, Tony, what I'd ask you to do is get with your supervisor. Depending on where you work and your duty description, that would determine what priority you're placed in and when you'll be called forward to get your shot. So talk to your supervisor on that if you made the decision to opt in, and we can define it for you and then get you put into the queue so we can get you taken care of.
And then Tressa asked how this video is going to be made available for people that are not able to watch based off of shift work or whatnot. And we will forward out the link to this recording to the directors, and they will disseminate it to the workforce. Thanks.
Well, hey team, I know we got a kind of a pause here, but I really I cannot thank our hospital teammates enough, particularly Colonel Middleton and Colonel Freeman, who hops on here every now and then. But Nia, thank you so much. You've done everything that you've talked almost nonstop here for almost a complete hour. So truly appreciate your one, being a great team member, and two, your professionalism, because the knowledge that you share with us, it only helps us get better and protects the force. And I hope teammates, if you have more questions, hey, look, that's what these guys do. I mean, they are the experts. Don't trust the bald-headed guy sitting behind the TV here. They are the experts, and Nia knows it. She's my hero, and she and all of the teammates over there at the hospital, they have done a hell of a tremendous job fighting on the front line every day. If you have questions, please make an educated decision. And the only way you do that is you ask the experts, and Nia is the expert. So I truly can't thank you enough for coming over and and talking to us today. Hey, Garrison team. So if you're interested in having some more conversations, hey, let the PAO team know. Pat Young, the hospital PAO, is up there. We can work out. It might not be Colonel Middleton. She does have a day job, not working for Garrison, right? But they got some amazing individuals up there that have just as much knowledge as Nia does and can help us understand the fight that we're facing right now. Hey, remember, please don't let this information stop with you. You've heard the facts. You've heard it from, from the expert. Hey, spread the word. And if they still have questions, great, because communication is the only way that we can get past this, right? And educating one another. So I don't want to shut it down. I think we got just a couple more minutes. A lot of thank yous, a lot of things out there. But if someone has some more questions, Chris, I think we kind of give it maybe one more minute, unless Nia, you had any closing comments.
Well, I just wanted to say, Colonel Logan, thank you and you're welcome. I always enjoy these opportunities. I will say the very first one, I was quite nervous, but now I think I figured out that I enjoy chit-chatting and talking. And this is a great opportunity to see people's faces on screen and answer questions and, just educate and get the word out about the importance of this vaccine. So there's tons of resources online. So the Winn homepage, the Winn Facebook page, you can also ask questions through the Winn Facebook page, and there are folks that are online responding regularly, and they'll get those questions to us or answer them directly. So, we're here to support and we're here to treat and assist in any way we can. So if you have questions, again, feel free to post those in some of the resources or manners rather that we've mentioned today.
Hey, thank you, Nia. Hey, teammates, so here's what I'd ask you to do. If you are interested in getting the vaccine, please talk to your supervisor where you fall in on those priorities, right? When your priority comes up, when your time is available, please go see the hospital team. They'll take care of you, fill out your paperwork right there. And then you still have another chance to ask our medical providers right there one-on-one if you have some specific questions about your individual case, okay? But we got some great information today, and I really appreciate everybody for popping on. Hey, let me know how it goes. Give me some feedback. Talk to our PAO teams, okay? Maybe we put another one of these together. Hey, ma'am, thank you again. I think, Chris, unless you had something, we're good to go. And we'll record this and push this out to all the directors to make sure that they can review it, fast forward it, however they want to use that. Chris and the PAO team will get that out to you guys. But please stay safe, wash your hands, go get your vaccine. Thank you again, guys.
Thanks, Colonel Logan.